All right, in this quick hack series, we're going to be looking at runner's knee. So running month is May, and here we are, and we've got a whole bunch of people sheltered in place and deciding to go out for runs. And that means we're probably going to see a lot of pain take place because many people are not accustomed to going out for a run and suddenly they're taking it on. So we're going to see a whole bunch of things, including runner's knee. Runner's knee, interestingly enough, it may not have anything to do with running, but just more or less about how your structure is positioned against gravity and how you strike the ground. What we're going to do today, first, I must put a disclaimer out there that I'm neither a doctor nor a physical therapist or anybody with a license to really give advice. So you should probably consult your primary care provider or doctor before doing anything I'm about to say. I'm just a movement guy, and for 30 years I've found that by moving people into better alignment, pain has a tendency to go away, funny enough. So we're going to focus on the quadricep muscle. And the quadricep muscle is that muscle that goes off the top of your thigh. It attaches just below that bony part of the front of your pelvis and wraps down, and it kind of sheaths the kneecap. That tendon, we call it the patella tendon, and comes down and attaches right down to the top of your shin bone, known as the tibial tuberosity. So that quadricep muscle actually crosses two joints. It crosses the hip and the knee. Now, the interesting thing about this muscle is when you're running or walking, that one end is going to shorten much more than the other end, depending upon where your body is in space. For instance, when you come down on that leg, the knee flexes, all this tissue should be lengthening out. But the pelvis is rolling forward, so this tissue is actually kind of shortening. So we've got one end that's lengthening while the other one's shortening. And then as I extend and push off, well, the pelvis here is posteriorly tilting, lengthening here, but my knee is extending, shortening here. So this muscle behaves quite unusual compared to other muscles you might know of, like the bicep, where it's all shortening when I flex my arm and extend my arm, it lengthens. So sometimes what happens, runner's knee, so to speak, patella femoral syndrome, patella tendonitis, all those things may very well have to do with the behavior of the quadricep. So we're going to start by doing a little bit of soft tissue work on these areas. The first area, I think I'll start with the stick here, and I am just going to simply apply a little bit of rolling pressure around the area just above my kneecap. Now I can go down below my kneecap and get into the tendon, but there's not a lot of blood flow in there. I'm going to go where there's the most amount of circulation and try and just rehydrate and circulate the fluid all through there. And of course, you can go higher up toward the mid quadricep or even further up toward the crease of your hip, but I'm going to take this sports stick, and of course if you don't have one of these, a water bottle may work well, or a rolling pin out of the kitchen, anything that's going to allow you to apply pressure and roll. So there's a few seconds there, and now that's got this area hopefully a little bit more pliable. Then I'm going to take my little friendly orb here, where you can get from ProTech Athletics. There you go, sponsored right there, not by ProTech, just it's a nice little company up out in Washington State that has a cool little product that's a foam ball. I'm going to take it and place it right in the crease of my hip at the top of my quadricep area and lay down slightly with it. And I'm going to roll in that area looking for some tender spots, but not trying to annihilate it. If it's too tender, then obviously don't keep on trying to roll back and forth over it. Just go in an area where you just feel like, oh, okay, that's nice. That's going to kind of give me a little bit of release in that area. All right. After a little bit of time doing both of those, my hope is that these areas have opened up. So I'm going to start in the more proximal, or what we would consider the area that's closer to my center in terms of my quadricep. I'm going to use this box here and gently lower myself down to the ground. I'm going to maintain a fairly level pelvis. It's not going to be tilted forward or backwards. It's just going to be level. And with my leg back behind me, and having that knee flexed, it's going to ask the quadricep to lengthen out a little bit more. And I'm simply going to glide forward about an inch. If you do this properly, you're immediately going to get that stretch sensation in there and lengthening it. I might do that for about a minute or so. And then I'm going to bring myself up into this position here. Same leg. I'm going to bring it forward, and I'm just going to load over onto this knee. The knee is going to travel in the direction of the big toe. Can I get this area to lengthen out? Keeping my body nice and upright, my pelvis will gently rotate away from the forward leg in the direction kind of toward the back leg. So with my left leg forward, pelvis rotates right, and I'm just gliding that left knee over the big toe of the left foot, trying to explore the movement that should occur to re-educate the muscular length that should occur and the behavior that the quadricep should be having as I do these movements. There you go. Just two quick little things in terms of movement, two quick little tools to try and open up that area. Walk around, see how that feels. Did that alleviate the symptoms in any way? If it did, well, there you have it. There are some things that you could have in your toolbox that you could pull out anytime you feel those symptoms occur. Remember, these are just symptoms. It's not the problem. Don't know what the problem is. It could be anywhere in your body that's making those actions occur in your knee. So we could continue to put a lot of attention in the knee, but it could actually be coming from the opposite hip or this shoulder that isn't moving properly, that's forcing you to load into that area in such a way that's irritating it. So that's not what we're doing here. Just the quick little hacks to try and get you through the day. If you want to explore where those problems may be coming from, well, then give us a call. I hope this helps. Before you go, our new book, Return to Center, breaks down everything we did today and a whole lot more. So check it out at rockysnyder.com. Our link is on our page too. If you still haven't subscribed to this channel, please do. Thanks for watching.